Good morning, everyone, and welcome to the Medicare Overview and 2026 Information Presentation. My name is Ginger Rogers, and I am the Medicare Outreach Specialist for Milwaukee County. And today we're going to do a brief overview of Medicare. We're going to talk a little bit about Medicare Part A and B. We're going to talk about Medicare Part C, which is Medicare Advantage. We're going to talk a little bit about Medicare Part D, which is Medicare prescription drug coverage. We will also have two of the people who are collaborating with Milwaukee County in giving Medicare information to the residents of Wisconsin, Ingrid Kundinger from, from a senior Medicare patrol, and Nick Lutz from the state of Wisconsin Medigap helpline. Thank you for attending, and we're going to just start in right into this right away. So, um, just 1 second. Let me admit that person. Okay. The collaboration, as I said, is with the Board on Aging and Long-Term Care, that's Nick Lutz, and the S&P Senior Medicare Patrol, which is Ingrid Kundinger. I do have to acknowledge that this presentation is being funded through a grant through the federal government, the Administration for Community Living, which gives money to the state of Wisconsin to present the State Health Insurance Assistance Program, the SHIP program, which will is there for all Medicare beneficiaries in the state of Wisconsin, no matter their age or disability. Today we're going to learn about Medicare. Like I said, a brief overview. We will also talk about Medicare supplements. We will talk about Medicare fraud and scams. We're going to learn why Medicare open enrollment is so important. And today we'll also learn a little bit of information we have about what is new for 2026. So, brief overview of Medicare enrollment, Part A, B, C, and D. What is Medicare? As you all know, Medicare is a health insurance for people who are 65 years old and older, under the age of 65 with certain disabilities, and anyone at any age with end-stage renal disease, that is, kidney failure. It is administered by the Centers for Medicare and Medicaid Services, short acronym CMS. And initial enrollment into Medicare is done by Social Security. To enroll in Medicare, all you have to do is visit Social Security, either their local office, call their toll-free number. You can do it online at www.ssa.gov, or you can get an application and mail it into Social Security. For those who are on the railroad and work for the railroad, they have to go through a specialized enrollment process through the Railroad Retirement Board. For those who are enrolling in Medicare, Medicare is only automatic for those in certain situations, and those are for those who are receiving Social Security benefits. And that could be either Social Security retirement or Social Security disability. For everyone else who is age 65 and not receiving Social Security benefits, Medicare is not automatic. You have to actively apply. And this is usually a person is still actively working at age 65, or they're not working. Say, for example, they retired, but they are not taking Social Security. And for those who are not receiving Social Security retirement or disability benefits. At age 65, and if a person is covered by an employer plan, if they are 65 or older and actively working, A lot of employer plans ask that a person enroll in Medicare. Every employer is different. So, if you turn age 65 and your employer needs you to enroll in Medicare before you do anything, that you would need to contact your employer, either their human resources, or check with their plan or the information that you get from the plan, and find out how Medicare will work with that plan and if and when you should enroll in Medicare, because Medicare may be primary or secondary to the employer health plan. Some employer health plans may require enrollment in Medicare Part A and or Part B. Again, your HR or customer service with the plan should be able to tell you exactly what to do. So when do you enroll in Medicare? When you are turning 65, you have what is called an initial enrollment period, which lasts 7 months. It is a time frame in which you can enroll in Medicare, no questions asked, and you will receive your Medicare card. There are other times you may enroll, but if you delay enrollment, there may be penalties in play because of that delay. If you have delayed enrolling in Medicare after the age of 65, then you need to check with someone and find out exactly what is going to happen next and when you can enroll. Now, we've talked a little bit about enrollment because that's how this all starts. Once you enroll in Medicare, then you need to know that there are different parts of Medicare. Medicare has what is called Part A, which is hospital coverage, Part B, which is medical coverage, that's going to your doctor, and Part D, which is prescription drug coverage. Part C is not actually a part of Medicare. Part C, also called Medicare Advantage, is an alternative way to get your Medicare benefits. Medicare Advantage Part C can have Part A, Part B, and sometimes Part D bundled together with a insurance company that has signed a contract to provide your Medicare benefits. We will get into a little bit more about that in just a couple of minutes. Once you are enrolled in Medicare, everyone starts out with Original Medicare. Everyone. When you receive your Medicare card, you get a card that says you are enrolled in either and Part A and or Part B. That is Original Medicare. When you get that, you can add on a Medicare supplement to help with the cost of Medicare. And you can also add on Medicare Part D, the prescription drug coverage. When you are enrolled, you have the option to stay with Original Medicare or go to a Medicare Advantage plan. Those are your options. Everyone starts with the Original Medicare. Then they have the option to go to a Medicare Advantage plan if that is the way they want to get their coverage. And Medicare Advantage combines Part A and B and may include Part D, um, prescription drug coverage. Not all plans have that. Let's go into Original Medicare and talk a little bit about Part A, and Part B, and Part D. Original Medicare. Everyone who enrolls in Medicare, as I said, starts with Original Medicare. When you have Original Medicare, you can go anywhere in the United States and see a medical provider as long as that medical provider accepts Medicare. Medicare covers you as the beneficiary and not the provider. The provider says, just like with any other insurance, yes, I will accept the payment for the services I give you as the Medicare beneficiary. And that is how that works. It covers you, not the provider. Now, once that provider accepts Medicare, and they do have to enroll in Medicare to be a provider, they can bill you for portions of their costs that Medicare does not cover because Medicare has its own rates for that it will pay for covered services. Let's talk about Medicare Part A. Part A is hospital services. This is when you are admitted into a hospital as an inpatient. When you are admitted into the hospital under Medicare Part A, the hospital must tell you that you are admitted as an inpatient because in some cases you can be put in a hospital bed and still be considered an outpatient. So the hospital has rules that Medicare has set up that they must follow, and they must tell you that you are admitted as an inpatient. Also, Medicare Part A will cover skilled nursing facility rehabilitation or nursing home. There is a limited payment for that, though, but there are rules surrounding admission and coverage of a nursing home admission. You do have to be in the hospital for 3 days before Medicare will pay for you to be admitted into the nursing home. Medicare Part A will also cover home health services, and the home health services that it will cover are usually skilled medical home health services, such as specialized wound care. For example, you have open heart surgery, the doctor sends you home, and he wants to make sure that that wound from the open heart surgery does not get infected. So he or she wants to have a, a nurse come in and change your dressings. That would be specialized wound care, which can be a home health service. Also, Medicare Part A will cover hospice services. Hospice services are end of life services where you have decided to let whatever your medical condition is run its course and you're expected to not to live more than 6 months. Each one of these things are different. They are all covered under Medicare Part A. Medicare Part B are your medical services. Medicare Part B is for you to go to the doctor for lab work, x-rays, outpatient services and supplies, um, occupational occupational therapy, physical therapy, outpatient mental health services, durable medical equipment such as wheelchairs, crutches, preventative services such as cancer screenings and the flu shot. It also will cover an annual wellness visit. An annual wellness visit is not a physical. It is a visit where the doctor assesses your overall situation, and it can be covered by Medicare Part B. Ambulance is covered, and also because it's all back in the news again about COVID, COVID vaccination and booster shots are covered under Medicare Part B. The COVID testing, though, is only covered free when a provider orders it and it is done by a laboratory. Those who are in Medicare Advantage plans, um, who can bill differently for things, might have a charge. One of the things that happened during COVID was that there was an upsurge in telehealth visits. Telehealth visits are still being covered by Medicare and may be free of charge through right now, September 30th. And the big one that everybody um, wanted and is still going on is that there's a $35 per month charge for insulin that is used in durable medical equipment, such as an insulin pump. Medicare Part D is the prescription drug coverage part of Medicare. First, it is a voluntary program. Excuse me. The law actually says voluntary prescription drug coverage. It is voluntary. A person must be enrolled in either Part A or Part B. You can choose a plan and join to get prescription drug coverage. Under Medicare Part D, plans have signed a contract with Medicare to provide prescription drug coverage. Every plan is different. Every plan has their own formulary. That is the list of covered drugs. That means, so one plan may cover, let's pick Eliquis, and another plan will not cover Eliquis. Every plan is different. Every list of covered drugs under a plan is different. Plans also have regional service areas. Regional service areas are the different places in the United States that plans operate in. In the state of Wisconsin, if you are getting a Medicare Part D plan, that is a Part D plan that is not part of a Medicare Advantage plan. Those plans are available in all of the state of Wisconsin. Wisconsin is its own region, the entire state. As I said, plans are different. Every plan can have different premiums. Every plan can have a different deductible. It can have a different coinsurance amount, which is a percentage of the cost of a medication, and it can also have a different copay. Every single plan is different. They may seem similar, but they really are not. Now, for 2025, there were some changes made to Medicare Part D. And one of those changes is that there is the Medicare prescription payment plan, where a person can spread out the cost of their medications over a year. And also, this is not new, but it is there and it has been there since the beginning of Medicare Part D, which started in 2006. There is help for those who need help to pay for their prescription drug costs. You may have seen the commercials. The commercials are available for people to are there, and they say call Social Security to see if you're eligible for extra help. It's real. It is not a scam. I've had that question a number of times since these commercials started showing up in July, and it is real. This is not a scam. Now, before we talk about Medicare Advantage, there's a couple of things I wanted you to understand that original Medicare does not cover everything. Never had when it was first established in 1965, and still now in 2025, At its 60th birthday, it still does not cover certain things. And number one is a routine physical. If you go to your doctor and you want to have a physical, it is not going to be covered under Medicare. You're going to pay full price out of your own pocket for a routine physical. Most dental care and dentures are not covered under Medicare. Hearing aids and fitting exams are not covered under Medicare. Routine eye exams for nearsighted, farsightedness, those are not covered under Medicare. If you have to have glasses after a, say, for example, cataract surgery, Medicare will pay for prescription glasses. But for routine eye exams, for glasses, Medicare does not pay for that, nor will they pay for the glasses. Most cosmetic surgeries are not covered. Now, we're not talking about if you have an accident and they need to, you have a cut on your face and they need to fix that. That's not like going in and getting a facelift. That can be covered, but most cosmetic surgeries are not covered. Massage therapy, acupuncture are not covered under Medicare, original Medicare, and long-term care. Long-term care is when you are admitted into, say, for example, a nursing home, and you're there more than a short amount of time. Medicare only covers you in the nursing home up to 100 days. After that time, you are on your own and you owe full amount to the nursing home. We're not going to go into that because we only have an hour for this today, but just so that you know, most long-term care is not covered under Medicare, original Medicare. Now we're going to talk about Medicare Advantage, also known as Medicare Part C. And as I said before, it is an alternative way to get your Medicare covered services. Medicare Advantage, when a person is enrolls into a Medicare Advantage plan, they are still in Medicare. Your Medicare does not go away. It is still there. Original Medicare is dormant. That means it's there, but it's not working. And even though you may enroll into a Medicare Advantage plan, you will continue to pay the Medicare Part B premium. A Medicare Advantage plan will include all Medicare Part A and Part B covered services. And in order to enroll in a Medicare Advantage plan, you must be enrolled in Medicare Part A and B. Now, a Medicare Advantage plan may have a provider network. And also, it may require referrals to go see a specialist, and it may require prior authorization of certain services. Plans may also include Medicare Part D prescription drug coverage. Not all plans do, but many do. It may also include extra benefits, for example, vision services and dental services. They will have a provider network, and plans are regional. And all plans are not available in all counties in Wisconsin. So Milwaukee has 38 different Medicare Advantage plans available. But some of these plans that are available in Milwaukee County are not available in Brown County or in Rock County or in Dane County. Every county in the state of Wisconsin is different. So if you have a friend or a relative who lives in one county and says, "Oh, I'm on this plan and it's great," it may not be available in Milwaukee County. Plans may also have additional premiums, and also plans have annual out-of-pocket limits. This means that plans can charge for medical provider visits, lab, x-rays, hospitalization, etc., up to a maximum out-of-pocket amount every year. Once you reach that maximum out-of-pocket amount, say, let's just take, say $10,000, the plan will pay for everything and you owe zero. But there are monetary limits that you have to meet with most Medicare Advantage plans. So, we've talked about original Medicare, talked about Part A, B, and D. Now I'm going to turn it over to Nick Lutz, um, who was with the Board on Aging and Long-Term Care, and he is going to talk to you about Medicare supplements. Take it away, Nick.
Hi there. Thanks, Ginger. Yeah, I'm going to jump in and cover some information about Medicare supplement policies. The first thing I want to address is just what is a Medicare supplement policy? So they're private insurance um, policies that are designed to help with some of those out-of-pocket costs in original Medicare. So that's parts A and B that Ginger covered. And these policies are regulated and approved by the Wisconsin Commissioner of Insurance. So when we talk about some of the, other components of Medicare, whether that be original Medicare or Medicare Advantage, a lot of those programs are regulated more at the federal level. Medicare supplement policies are a little bit different where they're regulated more at the state level. So our Commissioner of Insurance does the regulation and approval of these policies. And again, they're designed to offset some of those costs in original Medicare. Typically, they're going to cover a very large deal of those out-of-pocket costs. And the way Medicare supplement policies work is actually quite simple. They're going to pay after Medicare. So once Medicare pays for a service, you might have an out-of-pocket cost of 20% if it's a Part B service. That Medicare supplement policy is going to cover that out-of-pocket cost. And of course, these policies are going to have monthly premiums. The cost of those premiums are going to vary on a litany of factors, including the insurance company, which is the biggest factor, the optional benefits you're selecting, the age of the applicant, where you live. So your zip code can affect the monthly premium for a Medicare supplement policy. And again, how it works is once Medicare pays for an approved service, your Medicare supplement policy is then going to pick up its corresponding cost sharing. And the nice thing with Medicare supplement policies is they are guaranteed renewable insurance, meaning once you have the policy, as long as you pay the premium, you keep the benefits included in that policy. That's very different than Medicare Advantage or Medicare Part D, where you have to review the changes to your plan each year. So Medicare supplement policies are going to remain the same for as long as you pay the premiums. So there's no need to review your supplement policy each year. Next slide, please, Ginger. Oh, here we go. So the types of Medicare supplement policies, there's a few different types, and many insurers in Wisconsin offer a variety of these different types of policies. The first and the most common one is a traditional, or sometimes referred to as a basic Medicare supplement policy. Um, and the way those policies are going to work is they're pretty much just going to pay after Medicare pays and have a small deductible for Medicare Part B and potentially a small deductible for Medicare Part A. And then they're going to cover those out-of-pocket costs for Part A and Part B covered services. The next one is a cost-sharing Medicare supplement policy, which is exactly what it sounds like. You're going to pay a little bit more cost sharing when it comes to those services in exchange for a lower premium, typically. And then the next one is a high deductible Medicare supplement policy. Again, that one works exactly like it sounds. You're going to pay a deductible, and then after that, your Medicare supplement policy is going to cover some of those out-of-pocket costs. And again, those two types of policies are typically purchased in exchange for a lower premium, maybe than that traditional Medicare supplement policy. And then the last one is a Medicare Select policy. That is essentially a Medicare supplement policy that has a network of providers. And I do have a really great note, I think, on the bottom of this slide that your Medigap premiums or your Medicare supplement policy premiums are typically going to increase each year due to cost of living, cost of healthcare adjustments. It is normal for premiums to increase. With Medicare supplement policies, very rarely do those premiums ever go down. Next slide, please, Ginger. Now, all the Medicare supplement policies that are sold and purchased in Wisconsin are going to include both the basic benefits, which I have listed here. Essentially, that's just a little bit, a listing of things that they cover on top of original Medicare, or that original Medicare might have out-of-pocket costs associated with. So the way to think about the basic benefits is that that portion of it works with original Medicare, kind of like how the rest of the supplement policy works, where it pays after original Medicare. Now, the component that's a little unique in Wisconsin Medicare supplement policies are our mandated benefits. So when I mentioned here that that Wisconsin has that traditional policy or the high deductible or the cost sharing, all of them are going to have the basic and mandated benefits. One of the mandated benefits that I like to highlight in this presentation is the 30-day non-Medicare covered skilled nursing facility stay. So this means your Medicare supplement policy is going to pay all or a portion, depending on how much the skilled nursing facility charges, of non-Medicare skilled care. So that means that if for some reason your Medicare stay in a skilled nursing facility ends, you still have these 30 days that as long as a doctor says that stay is medically necessary, your supplement's going to cover that skilled care. So that's a pretty significant benefit that I think gives folks some pretty good flexibility when it comes to skilled care compared to Medicare, which has more rigid requirements around covering skilled nursing facility stays. Next slide, please, Ginger. Now, I mentioned the traditional supplement policy. That supplement policy is going to have those basic benefits, those mandated benefits, and then you're going to have some deductibles and cost sharing. What these riders will do is attach to that traditional supplement policy to provide you additional coverage, typically in exchange for a slightly higher premium. So the first one is the Part A deductible rider. That's going to do exactly what it says. It's going to cover the Part A deductible for you. That can be a big cost savings if you end up needing hospitalization or anything like that. The next one is the Part B deductible, which if you had Medicare after January 1st, 2020, you can't have this rider anymore. Fortunately, the Part B deductible is pretty small. It's only a couple $100 each year. And once that deductible is paid, your Medicare supplement policy is covering those Part B costs. The next one is interesting. It's the Part B copay and coinsurance rider. This rider is going to reduce your premiums in exchange for a little bit of cost sharing. So this will require, small copays when you go to see your providers versus having no copay maybe with the traditional supplement without that rider. The next one is the Part B excess charges rider. This one's a little unique if you have a provider that is charging more than the Medicare allowed amount for a service. This rider will help cover that difference. I know this presentation specifically for Milwaukee County, but I think people have a pretty good awareness of like the Mayo Clinic in Rochester or some of those large health facilities that have specialists that might charge a little bit more than the Medicare allowed rate. This rider can come in quite handy to help cover those differences. The next two are additional home health days and then emergency foreign travel. And those two are exactly what they sound like. The emergency foreign travel is going to help cover some expenses that might be incurred outside of the United States. And then the additional home health care rider is going to offer additional home health care benefits on top of those basic benefits. Next slide, please. And then this is the other component about Medicare supplement policies that's unique to other Medicare coverage options that typically have yearly or initial enrollment periods. There are specific times when an individual can purchase a Medicare supplement policy without having to go through health underwriting, and insurers are required to sell them a policy. And those two periods are their 6-month open enrollment period, which is when you start Medicare Part B. If you're under 65 and you turn 65 and have Medicare, prior to that date, you're going to have an additional open enrollment period at age 65. But for most folks, that's going to be when they start Medicare Part B. And that's a 6-month window where the insurer is required to sell you a policy at their preferred rate. So that's a great time to purchase a Medicare supplement policy. The other time period, these are a little bit more unique and situation dependent, are the guarantee issue periods. Some examples of times where an individual might qualify for one of these guarantee issue periods to purchase that supplement without health underwriting and the insurer is required to sell it to them at the preferred rate is going to be a loss of an employer plan, a loss of Medicaid, or when using a Medicare Advantage plan trial period. So those trial periods are typically when you enroll in an Advantage plan for the first time, you have 12 months to try out the plan, and then you can either return to your Medicare supplement or purchase a new one depending on your unique situation. And again, I have our phone number here on this slide. Feel free to give us a call if you have questions about guarantee issue, purchasing a supplement, choosing between different kinds of Medicare insurance. Our licensed counselors can assist you and help answer some of those questions. And then the other time you can purchase a Medicare supplement policy is whenever an insurer wants to sell you one. One of the restrictions here is that if you're enrolled actively in a Medicare Advantage plan, an insurer cannot sell you a Medicare supplement policy. So you have to be an original Medicare. However, I will note that if you're not using the open enrollment period or a guarantee issue period, you might have a higher rate than somebody who is using those periods because of those health underwriting questions. And those are essentially questions about your health condition so that the insurer can assess the risk of insuring you. I think about it like when you're going to purchase car insurance, if you have tickets, you're likely going to pay more. If you're purchasing a Medicare supplement policy and you have significant health conditions, you're likely going to pay more. So that's a good way to think about that. The last slide I have here is just a basic overview of the steps to purchase a Medicare supplement policy. So the first step is to decide what kind of policy you want. So do you want a traditional policy with certain riders? Do you want a high deductible policy? Do you want a cost sharing policy? And once you figure out what type of policy you want, you're going to then find out which insurance companies sell policies in your state. The Wisconsin Commissioner of Insurance has a list of insurers that are selling policies in Wisconsin. That list is also available on our website. And using that list, you can call the various insurers that sell the Medigap policies and compare their costs, compare the premiums. And then the last step is just purchasing that policy. And like I said, once you purchase that policy, it's a guaranteed renewable insurance. As long as you pay the premiums, you keep the policy. And so that was a very general overview of Medicare supplement policies. Again, if you have any questions, please don't hesitate to contact us at 1-800-242-1060. I'll turn it over to Ingrid to talk about SMP.
Thanks, Nick. Hi, everyone. My name is Ingrid Kundinger, and I am here to talk to you a little bit about Medicare fraud and scams from the Senior Medicare Patrol program. So if you're new to Medicare, first of all, congratulations. Second of all, you might not realize that you will now be unfortunately the target of many more attempts to take advantage or for scams as a Medicare beneficiary. If you are already a Medicare beneficiary, perhaps you've already had some of these things that we're going to talk about happen to you or have heard friends or family members talk about that. So we're going to spend a few minutes just talking about the Senior Medicare Patrol program so that you know that we are here as a resource for you in the state of Wisconsin if you have any questions or concerns related to Medicare-related fraud and scams. So first of all, the Senior Medicare Patrol program, as you can see here, the mission is to empower and assist Medicare beneficiaries, their families and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. So we are a federally funded program, and there is a Senior Medicare Patrol program in all 50 states across the United States, as well as the 4 U.S. territories. Next slide, please. So maybe you're wondering why the Senior Medicare Patrol program is even necessary. And as you can see here, billions of dollars. That wasn't a typo, unfortunately. I did intend to type billions of dollars are lost annually due to healthcare fraud, errors, and abuse. Right now, the estimate for just the Medicare program alone is in the $60+ billion range. So as you can see, a huge issue for the Medicare program. And so the Senior Medicare Patrol program plays one small part in helping to educate and equip Medicare beneficiaries to prevent Medicare fraud from happening, but also to report so that we can submit information to the investigators at the federal level to catch up with the bad actors and hopefully put them out of business. Next slide, please. So just to give you a couple of examples, maybe you're wondering, well, I don't even know what Medicare fraud would look like. There's two pretty popular, if popular is the right word, types of scams that we often hear reported from Medicare beneficiaries right here in the state of Wisconsin. And the first one is related to a new Medicare card scam. So what this scam means is that there are people who are making calls to people on Medicare, asking them if they've received their new Medicare card yet. Oftentimes people would be caught off guard thinking, no, I didn't know there was a new card. And then the fraudsters are going to kind of take it from there. So the important thing for you to know is that there's not a new Medicare card. So if you're new to Medicare or will soon be enrolling, as Ginger mentioned earlier, you will receive that paper red, white, and blue card. You can see the image of that here on this slide. It's nothing fancy. It's literally like kind of cardstock, basic, nothing glamorous. So the fraudsters are saying it needs to be plastic. It needs to look like a credit card. It needs to be laminated. It has to have the chip reader in it, all sorts of different things. It's orange, green, and yellow because red, white, and blue is expiring. So the main thing here is that there's not a new Medicare card. So if someone calls you about this or you hear someone talking about that, please, if you're on the phone with someone, hang up the phone. They're looking for you to share your information. If you hear friends or family members discussing this, interject that you've learned that there's not a new Medicare card in hopes of preventing people from sharing their Medicare information. The second most reported type of Medicare related scams and fraud relate to durable medical equipment. So this is back braces, knee braces, wrist braces, diabetic supplies, CPAP machine supplies, all of those different things. And there's a lot of commercials you might see or telephone calls with companies calling you out of the blue on a Wednesday afternoon, asking you if you have back pain. Now, I don't know about you, but for me, that would be like kind of a really weird phone call to receive out of the blue from a company that I didn't ever do business with, wasn't familiar with. So our word of caution there is that if you do need some sort of durable medical equipment, talk to your healthcare provider directly about that. Don't respond to a television commercial. Don't answer the questions to the random person who's calling you on the phone. Medicare does pay for these things, but it needs to be done through your healthcare provider so that the appropriate order can be placed and the appropriate company that you would receive that from would be involved in that. So again, just be really cautious when it comes to those few things. Next slide, please. So what can you do to help prevent Medicare-related fraud and scams? The first thing, protect your personal information. That means, like I said earlier, be really cautious. Medicare is not going to call you on the phone. The Social Security Administration not going to call, the IRS not going to call. So just be really aware of people who are calling and asking for your personal information, and really take your time in determining who you might share that with. Our advice would be that if it's not your healthcare team, the pharmacy, that those folks don't really need that information. So really keep your information private. The second thing that we talk about a lot is detect. How can you detect if something were to be wrong with your Medicare account, for example? And so we really encourage people to review all of their statements on a regular basis. So if you have original Medicare, you're going to receive from Medicare directly a Medicare summary notice. It's not a bill, it's just an overview of all of the claims that were submitted with your Medicare information during that certain quarter time period. So when you take the time, and yes, the forms can be a little bit cumbersome when you first get started in looking at that, but as you do that regularly, you'll be more familiar with kind of what stands out, what you're looking for. So you just want to make sure that all of the things that are listed on that Medicare summary notice are actually things that happen to you in a clinic or hospital by providers that are familiar to you. So if you live in Milwaukee and you opened your Medicare summary notice and noticed that there were a bunch of medical supplies listed on your summary notice from a supply company in North Carolina that you weren't familiar with, that would be a red flag, and that would be a reason to contact the Senior Medicare Patrol so that we can get that reported as suspected fraud for the investigators to take control of that. So if you have a Medicare Advantage plan or with your Part D prescription drug plan, you receive explanation of benefit statements, again, similar to the Medicare summary notice in that they are going to provide you with an overview of all of the things that your Medicare or your insurance plan was charged or claims submitted during that time period. So just very important for you to become familiar with those statements and look at them on a regular basis so that if there are things that stand out as red flags, you can reach out to get those corrected. And then lastly, report. So if you see something that doesn't look right, you can call our toll-free helpline. That number is here. You can reach us online as well. If you got a phone call and you were caught off guard, or you just woke up from a nap, or you weren't feeling well that day, and you accidentally shared your Medicare information with the person and then hung up the phone and thought, oh man, I should have never done that. Now what am I going to do? Call our toll-free helpline. We will walk you through next steps as far as if you share that information, what our suggestions would be to make sure that you and your Medicare account are going to be safe going forward. And so we're not judging you. We want you to call. We get calls from people across the state of Wisconsin every single day in all sorts of different situations. So no judgment. We'd rather that you call to say, oh my gosh, I shared my information. Now what do I do? So that we can help you put steps in place to make sure that your account is safe going forward, than for you to be embarrassed and not share that information. And then even more fraudsters maybe get access to your information to take advantage of Medicare on your behalf. And then next slides, please. Lastly, we do have some available resources. All of our resources are available at no cost to you. From our website, you can request to be added to our quarterly newsletter mailing list, which is the SMP Scoop. We also have what we call My Healthcare Trackers, which is a small notebook type resource that you can take with you to appointments to kind of keep track of date, who you saw, what happened really briefly, so that when you get your Medicare summary notices or your explanation of benefit statements, you have something to cross-reference what dates you went to the doctor, who you saw, and what happened at that appointment so that you can make sure that those statements are accurate. And then lastly, on our website, as I mentioned, there's a lot of different information as well. And if you have any questions or would like to receive any of these materials, you can call our toll-free helpline and we would be happy to share that information with you. So thank you very much. And I'm going to turn it back to Ginger to wrap up our presentation. Thank you.
Thank you very much, Ingrid. One thing I would like to add to Ingrid's presentation is that when you get a call and they say, is this Mary Smith? Never say yes. Never say yes when these calls come through. They can capture your voice saying yes, and things can happen. So, and if that happens, call the Senior Medicare Patrol. Okay, we have just a few minutes left, and I'm going to talk a little bit about Medicare open enrollment. Medicare open enrollment is a time every year, October 15th through December 7th, almost 8 week period in which you can review all of your Medicare options. It's time to review your current plan and determine if you will stay with your plan for the coming year or change to another plan. It is very, very, very important that you read all of the information that your current plan sends you. I have been doing this for a very long time. I have seen nasty surprises at the beginning of the year. And in order to mitigate that, you need to know what's going on with your plan. You don't want to have surprises at the beginning of 2026. If you don't understand, help is available for you, for someone to talk to you about the information you have received and help you walk your way through it. And we'll talk about those resources at the end of this presentation. So, what's new for 2026? Well, Medicare has not released that information yet. We're still waiting. We don't know about any new plans yet, unless it came out this morning. And of course, we're doing this, and I don't know that, and I can't see that yet. But at the time I wrote this, we don't know what the new plans are for 2026. We don't know who's staying, who's leaving, what is going to be changing. But I can give you a little bit of information. New Medicare costs, the new Medicare premium, the new Part B premium, the new Part B deductible, the Part A deductibles that everyone is liable for. Those costs are usually available. The federal government puts those out around the end of October, first part of November. So I'm thinking that that'll be another 3 or 4 weeks before we have any of that information. But you do have to be aware of a couple of things. And this is why it's so very important that you look at the information that you will have started to receive already, because plans have to follow the rules and regulations under Medicare. Plans can change their premiums, cost sharing, and coverage every year. A plan, especially Medicare Advantage plans, a Medicare Advantage plan that had no premium this year, for next year may have a premium. They may change coverage of their medications. A medication that you take may be covered now under Medicare Part D, under that Medicare Advantage plan, or under that standalone prescription drug plan, and will not be covered the next year. This is why it's very important that you take a look at this. Plan premiums can go up, plan premiums can go down. Under Medicare Advantage plans, can change their provider network. They can change their pharmacy network. Hospital, clinics, doctors can decide that they no longer want to accept a certain plan. We have that going on right now in Milwaukee. And you need to keep on top of this. You need to know what's going on. So this is why when you receive something from your current plan in the mail, and like I said, the law says they must send this information out starting in September. And most plans, they comply with this, and they get that information out to you Please read that information. And the last one, which is most important, is that plans can leave Medicare. They can actually say, we are no longer going to be part of Medicare and we are leaving, and our plan will actually come to an end. They have that right to do that. If you receive a letter and it says something like that and you panic or you don't know what to do next, please call for assistance. We are here to help. So those are the things that I think that you really truly need to pay attention to for the upcoming open enrollment period and to keep an eye out for. Now, for more information and for assistance, I have listed here all of our information, including the 1-800 Medicare telephone number. Call 1-800 Medicare, or you can go to the official Medicare site, medicare.gov. Every single information on medicare.gov, not com, that's not official, medicare.gov, all of that information is correct. There's nothing wrong with that information. You can be assured that you're getting accurate information, because all of us with the Medigap helpline, with Milwaukee County Aging and Disability Resource Center, with me, with the outreach and counseling, we all use Medicare.gov, and we all look at that information in order to help you. The Wisconsin Senior Medicare Patrol, they also look at all of that information. We all keep on top of the information that comes out from the federal government, because that is what we do. We are all certified and trained to do this. So please, if you have any questions, give us a call. We're there to help. And we will, and we do it judgment free, unbiased, and we won't try to sell you anything. So that's the end of this. I hope this helped. And now we can open it up for questions. If you have a question, please unmute yourself and we'll be happy to answer.
Will
Okay.
this presentation be available for you to send as an attachment to us or to review?
Did you get the PDF?
Oh, yes, I did.
Yes, there should be an attachment that has the slides on it.
Gotcha. Thank you.
Okay. This is being recorded, so you will be able to listen again if you like. As a matter of fact, I'm going to pause the recording at this time. And any other questions? Okay. And then thank you everyone for attending. Thank you, Nick, for presenting on Medicare supplements. Thank you, Ingrid, for presenting on Senior Medicare Patrol and fraud and scams. And thank you everyone for attending. Have a good rest of your day. Thank you very much.